bad news last week, North Attleboro, Plainville, designated red communities.
Right.
Good news, England started giving the vaccine this week. Hopefully, by the end of the month, frontline workers will be receiving the vaccine.
Right.
I think it's safe to say we're not out of the woods yet.
Oh, unfortunately, no. I mean, we still have holidays coming up that have large crowds associated with. We have Christmas masses, we have New Year's celebrations, things where people tend to want to be with others, with friends and family. Our numbers are huge. Thanksgiving, unfortunately, did have an impact. Our numbers are just going through the roof. We're at 967 right now cases. So we did over 200 cases last month alone. So
Wow.
yeah.
I know on the national level, record numbers this week, and the experts were saying that does not even include what the Thanksgiving Day break and people getting together will ultimately lead to.
Right. It also, a lot of times, doesn't include probable cases, which are real cases. That's one of the frustrations sometimes with the counting of numbers. People will say, gee, I look at the state numbers and they say X and your numbers are so much higher. That's because we count the probables, which are antigen. They are positive. They have had the tests. Some of them have symptoms, but it would be worse. If they included those numbers too. People would really probably be appalled at what the numbers are. So it's a challenge. It really is. A lot of people were very good, but there was a number of people who weren't. That's what we're seeing with the cases that we're getting.
I know I've asked you this before and you're probably tired of answering it, but how important and what difference does it make if people are faithful about wearing the mask?
It makes a huge difference. People don't realize it's just that extra barrier between people who ultimately become positive. The stories that we're hearing is that people went to have Thanksgiving, and it may have been all with family, but with your family, you don't wear masks. People don't. They don't separate. And then they hear, 3, 4, 5 days later that their uncle, their brother, their aunt, their sister have become positive. They get tested and they become positive. They're a contact first and then they become a case. And then it goes through the families. That's what we're seeing actually a lot of, is family transmission. Before, I think everybody was so careful and they would get so sick. It's mild now. A lot of people are asymptomatic or they have cold-like symptoms, and then they get tested because they're a contact, and we find that the whole family's positive.
And then finally, the vaccine. I know the federal government is allowing the states to determine how it will be administered.
Correct.
Does North Attleboro have any say, or do you get instructions from the state level?
I would get instructions from the state. Right now it's looking, the priorities, rightfully so, are going to be the hospitals first. They're the ones dealing with the sick patients. They're going to do long-term care. That's where we saw the most fatalities, so they want to make sure they protect those very vulnerable people. They'll be doing the fire and police. As far as public health, like personally, we're down in that second tier with teachers, with those that have multiple comorbidities, and that I don't think we'll see until next year sometime.